I remember when I was young, in my teens and 20s, reading some of the first bits of research coming out on vitamin E. One of the first great antioxidant molecules to be researched as a nutritional vitamin and as a nutritional antioxidant molecule. Back in the 70s and such, some of its first research was on its antioxidant capabilities, and as such, as an antioxidant, its value in cardiovascular health and preventing cardiovascular disease. Now, since those studies, there has been numerous scientific published research articles on vitamin E as a valuable nutrient in many various biological, cellular, and bodily functions. I'm going to talk about two particular vitamin E's. One is called Ultimate E. It's a product from Thorne Research. Why is this an important vitamin E to be discussed? Well, there are a couple different forms of vitamin E, or tocopherols. There is alpha, beta, and gamma tocopherol, for instance. Of these tocopherols, or this tocopherol complex called vitamin E, the gamma tocopherol is one that has been particularly looked at for its value in protecting against cardiovascular disease and for its anti-inflammatory capability. And so Ultimate E is a vitamin E that is formulated with extra gamma tocopherol. So it's weighted in that particular form of vitamin E, which makes it even more valuable in the treatment of cardiovascular disease, but also I use it in the treatment of chronic inflammatory disorders, such as rheumatoid arthritis and various autoimmune disorders, because of its high amount of the gamma fraction. There is another vitamin E that I find very, very important, and we use a lot in this office, and that is vitamin E succinate. So it, as a succinated form of vitamin E, it is the dry form, or powder form, if you will, of vitamin E, not vitamin E in the oil base. And as this dried form, vitamin E succinate, it acts quite powerfully as an anti-apoptotic agent. Let me describe what that is. Apoptosis is the ability of a cell to destroy itself, to self-destruct when it begins going awry. Why is that important? Because in the early development of cancer, as those cancer cells develop, many different cancers will shut down the cell's ability to self-destruct as it becomes cancerous. And this then allows for more proliferation of the cancerous cells. Now, vitamin E succinate turns that mechanism back on and allows that cell then to self-destruct. So, vitamin E succinate is a very, very important nutrient in the adjunctive treatment of various cancers. So I use it a lot with my patients in the treatment of their cancer. And if they've had a history of cancer, to further prevent future development of cancer. There are studies that have shown its value adjunctively with chemotherapy, as well as with radiation therapy. Even against what your radiologist may say, your radio-oncologist may say, even against what your oncologist may say, I'm telling you that the literature is clearly there to its value adjunctively while you're taking the chemotherapy, while you're doing the radiotherapy. It improves the cytotoxic kill rate, if you will, of the cancer cells. So there are studies to support its use in these situations. The outcomes, or the cytotoxic kill of the cancer cells, is much better when the vitamin E succinate is given adjunctively. Now, one last thing is also in cancer treatment, particularly with certain chemotherapeutic agents like adriamycin, for instance. There is a toxicity it can cause to the heart, causing a cardiomyopathy, which is an enlargement and degeneration of the heart muscle. Vitamin E, when given with these medications, these chemotherapeutic agents like adriamycin, can reduce those side effects on the heart as well. So these are three very, very important vitamin E's, or excuse me, two very important vitamin E's and three very important reasons to use vitamin E, both the succinate and the ultimate E. So the ultimate E for inflammatory autoimmune disorders, to reduce the inflammatory process in treating various cardiovascular diseases, and the vitamin E succinate in cancer therapy to improve the cytotoxic kill rate of cancer cells during chemotherapy and radiation therapy, and causing those cells to self-destruct more easily, and also to prevent the side effects of some of the chemotherapeutic drugs. Thank you.